Practice Ready Assessment Pathway. Do you know that British Columbia has removed MCCQE1 and NACOS key for family physicians and general practitioners to come and practice in British Columbia, Canada? So in this video, I'm going to take you through step by step of the requirements that are needed for you to move from your country to practice as a family physician or general practitioner in British Columbia, Canada. So stay with me from beginning to the end of this video. I'm also going to give you the website where you can go and get more information and also download the requirement by yourself so that you will use it as your checklist. Anyone you get, you check it off. Anyone you get, you check it off. And on that link that I will give you, you also see the webinar link where you can register for their webinars and attend any of the webinars so that you get more information and have the opportunity to ask questions. And in this video, I'm also going to give you webinar tips on how you can ask questions and get your answers without coming off either pressuring the person or coming off insultive. Then that takes me to welcoming everybody back to my channel. I use a returning subscriber. Please, you're welcome back. Feel free to share this video, like it, and drop your comment. And if this is the first time you're coming across my channel, you're highly welcome. I bring you intelligent videos, so feel free to subscribe and hit your notification button so that anytime I make an upload, you will get it. You know, one thing about this video that I'm making now, it is time sensitive, and these are the kind of videos that I make, so you need to get the notification immediately I upload so that you can follow it up immediately without, as in before the time elapses. So let's go straight to what we have today. So once you get to the website, the first thing you're going to see will be something, this announcement. Apply to what? PRA-BC. This is what you're going to see on the website. And it's going to state, are you an internationally educated and trained family physician? PRA-BC has requested the assistance of Health Match British Columbia in the initial pre-screening of all PRA-BC applications. Find out the exact screening and selection criteria, which is what I'm going to take you through in this video to see where you fit and register with Health Match British Columbia. And the beauty about this is that you can do it from your home country without sweating. That's the beauty about it. And I want you to be happy for yourself, because I'm also happy for you that you will be doing this from the comfort of your home and in your home country without spending so much money trying to come to Canada to do it. You're going to see it in the criteria why I take you through. So when you get to the website, you're also going to see this announcement on the website, and it requires what? That as effective July 7th, 2025, less than 1 month as at the time I'm making this video, the College of Physicians and Surgeons of British Columbia has eliminated MCCQE1 and LMCC requirement for the assessment class of what? Licensure. The LMCC requirement is what? NACOS key. So NACOS key has been eliminated. MCCQE1 has been eliminated. And the beautiful thing about this is that applicants may apply from any country. So you can apply from your country, Nigeria, Ghana, Zimbabwe, South Africa, Zambia. You can apply from what? Any country. Then immigration status in Canada is not a requirement, is in caps lock, not required to apply for PRA British Columbia. So this is what? A very sweet thing, and I'm actually excited for you. I hope you are excited for yourself. And right now that you have seen this announcement, I want you to remove every limiting belief from your mind. Anything that limits you, that you are going to say, okay, the word, so many people are going to be applying, so I don't have chances, or I'm not going to get it. Delete it from your mind. Begin to tell yourself that even if they are taking one person, that you're going to be that one person that they will take. That's the mindset you should come with, because those people that usually put themselves down are the ones that are down. You don't need to put yourself down. You need to come with the mindset of what a winner, that you're going to fight through this and you're going to win it. What? By applying yourself, because most of us don't want to apply ourselves, but you need to apply yourself and do this from beginning to finish. So I'm just too excited for you. If you're still wasting time, please stop wasting time so that we can progress to what we have today. So that brings me to what? To the requirements. One, which is what? The eligibility requirement. I'm going to explain each and every one of them so that you understand. A medical degree issued by a school listed in the World Directory of Medical Schools. So your school has to be listed in the World Directory of Medical Schools so that they will know that you truly went to a medical school and that you did not go to any mushroom school out there. Then 2 years of postgraduate training in an international jurisdiction leading to registration or recognition as a general or family physician in that jurisdiction. So general practice for those in Nigeria is the same thing as what we are talking about. The thing is this: most of us say medical officer. Medical officer is a general practitioner, and that's what they are talking about here, provided that in your general practice you have not been out of practice for at least 2 years. You have not been out of practice for a maximum of 2 years. You can't be out of practice in the last 2 years. That's why I tell people, just don't be out of practice in the last 2 years. That gives you what? An upper hand. That's what I would call it, an upper hand. So consistently be in your practice as a general practitioner. We're going through it step by step so that you know anyone you don't have here, you still have the chance or the time to get it wherever you are. Then you can do what? The next one is what? Completion of 7 core what? Rotations. And these 7 core rotations, you know what you do. You need to do what? You need to do what? Do and do the 7 core rotations. Then a minimum of 4 weeks of postgraduate training in each of internal medicine, general surgery, obstetric and gynecology, pediatrics, psychiatry, and emergency medicine. A minimum of what? 4 weeks. Count it. Internal medicine 1, general surgery 2, obstetric and gynecology 3, pediatrics 4, psychiatry 5, emergency medicine what? 6. So you will have a minimum of 4 weeks rotations, postgraduate rotations, not as a medical student. Because when you're hearing postgraduate, you may be wondering why. Not as a medical student, as what? A graduate. Have you done rotations in this departments? If you have not done it, you can go and start doing it and make sure you meet this a minimum. In fact, if I were you, I would do more than 4 weeks. Then you also need what? A minimum of 8 weeks postgraduate training what? In family medicine. If you are not a family medicine resident, you can go in as a supra. A minimum of 8 weeks postgraduate training there. So you can decide to do 5 months, 6 months as you're planning this. It depends on what you want. You know what? If you know this is what you want, then you can go what? Go for it. That's the only thing I will tell you. You can go for it. Then completion of a minimum of 2 years of discipline-specific time in independent practice as a general or family practitioner. General practitioner is medical officer. So discipline-specific time. You need that discipline-specific time. You need it as an independent practitioner or a general family practitioner in that or another jurisdiction. In any jurisdiction, or like in Nigeria, we call it a medical, then have a senior medical officer and all that, a chief medical officer. So it depends on the one that you are, but you have a minimum of what? 2 years experience independently practicing. So it means you do all the emergency medicine, internal medicine, general surgery, obstetrics and gynecology, pediatrics, psychiatry, emergency medicine. You do all this. Make sure that you do it. Make sure that this is what you are acquainted, or you have acquainted yourself with. Then academic credential verification of medical degree. Your passports, postgraduate training letters that confirm completion of the 7 core rotations through physicians apply. So you're going to get that letter from the hospital where you are working, or from the like if you're the owner of the hospital, They need to know that you are the owner of the hospital. Then, if it's the hospital you are working, they need to know that this hospital, as in they do have enough patients and they do have all the things that you will be needed, like that you need to be trained as a doctor. So you should make sure that you have this letter and you put it for them. You know the 7 core rotations through what physicians apply, and that's why the website is. If you check in my previous video, I'm going to tag it at the end of this video. You're going to go there and see how to open an account with physicians apply. So when you open an account with physicians apply, you will go through this requirement. Then currency in practice, section 2 to 8 of the CPS-BC bylaws, a minimum of 24 weeks, that's 960 hours of clinical practice as a general practitioner or family practitioner in the preceding 3 years. So this long English here, the way I just put it together so that you understand it, is what I say: you should not be out of practice for more than 2 years. So in the last 2 years, let it not be that you have been out of practice for up to 2 years. That's just the simplest way I put it. So if you're currently in practice, fantastic. That is good for you. So don't say, when I come to Canada, I start. If you come to Canada and you start this process in Canada, if you're in Canada and you stay in Canada up to 2 years without practicing, that has made you what? Lose this criteria, which means you've been out of practice for more than 2 years. So you do not qualify for PRA again. So that's the reason why I am trying to explain this particular point, because I know someone that said, when I come to Canada, I will start it. I am telling you that you need to start it from your home country so that you will buy time. Even if you're coming into Canada, when you're coming into Canada, you will move faster and you will not elapse that 2 years that you need not to be out of practice. So you shouldn't be out of practice for up to what? 2 years. Let that sink, please. Then your current CV that fully explains all activities, professional or otherwise, even your volunteer experiences. And if you've not started volunteer, better be volunteering, because volunteer has a very high chances here. In fact, volunteer gives you opportunity in this country more than anything, because if you are able to volunteer, it means you have the mind actually to serve. So if you've not started volunteering, please volunteer. Why am I saying that my videos are time sensitive? Read this. This is actually from their website. Please note, PRA-BC pre-screening requirements are subject to change at any time without notice. So if you're seeing this video now, start your what? Application and clearance for everything. Open an account with physicians apply. If you have not opened that account, please go and open it now so that you start your document verification, start everything before this changes. I know why I'm saying it, because the laws can change anytime. You are not in control of it. I am not in control of it. I can only bring it to your notice once I see that there is any change or they have made changes. So this is for me to tell you that my videos are time sensitive. You have to what? Turn on the notification button so that once I upload, you will get it so that you can watch it. Then on the webinar, yes, they do webinar for physicians that want to practice in British Columbia, family physicians or general practitioners. So, but in that webinar, you have opportunity to ask questions. Why am I bringing this aspect? Is because you have to consider the cultural implication of the question you are asking, and also who you are asking the question. So that brings me to this point. Your ability to communicate effectively will leave a lasting impact on the presenter and the audience. Remember, in that webinar, you are not alone there. You are there with other doctors from different parts of the world. So how you present your question and how you present yourself is actually going to say a lot about you. Don't go there and be asking questions on things that are already on the website. Imagine going to ask them, is it true that they said they've removed MCCQE1? Does that make sense? It is boldly written on their website. Please, because these are some of the things that we do that even me, it pisses me off. You will see something. I don't know what you want to find out again by repeating something that is boldly written on their website. Make sure that whatever question you are asking, you actually sieve your questions so that you will not be throwing yourself under the trailer in a way that you are asking a question that on a normal day, as a doctor that have high IQ, you should know that. Then effectively communicating your questions will make it easier for you to get clarity. Remember, there are cultural differences. So how you communicate your question will actually determine how the person will answer you. Let me give you an example. I was once presenting and somebody wanted to ask a question. The person said, you said in one of the slides that so thing. That thing you said, I don't know, are we to believe it or should we not believe it? That was the person's question. Then I looked up, I looked down, and I said, the next thing I asked is, which country are you from? So these are things that happen during presentations. I'm saying this so that please, when you want to ask question, in fact, before you ask question, if you have somebody seated by your side, ask the person, does this question come off nice, or how does it sound? So that you will not be asking a question that even you, when you hear it outside, you will be like, how on earth did I ask this kind of question? So come prepared for that webinar so that you will get all the information you need. And the next slide you're going to see now, I'm going to show you a flyer of the webinar on how you can register for the webinar so that you attend that webinar and also have a first-hand information by asking questions directly by yourself. So this is the webinar. They had a webinar on the 10th of July. So I know that some persons registered for this webinar, but you can register for this webinar. You can see the website here, see PRA-BC.ca. Look at it here, PRA-BC.ca. So you can go there and register for this webinar. Anyone that is coming up anytime soon, you will get it there. Register for it so that you can come and ask your questions. Ask your questions, any type of question you want to ask, please feel free to ask, but make sure that the questions you are asking will make sense to you. So in this webinar, see, most times what they do is they explain how the PRA-BC application process works. They're going to explain it for you from beginning to end. Then they are going to share applicant success stories, and they are going to address your questions because there are many successful applicants. I know many. So the only thing is, what if you decide to limit yourself, good and fine. But if you do not decide to limit yourself, please, one thing that I want you to do for me is to what? Share this video, invite your friends, because I'm going to settle down and give you information in this area because I really want more doctors to come and join Canada, to come and join British Columbia and practice in British Columbia. Because you know what, the more we have doctors practicing in Canada, the more patient satisfaction, the more we actually clear up the backlog, and the more the waiting time reduces. Because most times when I look at research and I'm reading wait time, and most times the problem is usually wait time. So if we have more doctors in Canada, the wait time will do what? Will reduce. So come and join. And if you have watched to this level or to this time, please do what? Hit the subscribe button and make sure that you watch the next video that is popping up on how to do what? Open a profile with Physicians Apply Canada. Or having said that, have a nice day. Bye.